Good day and welcome to this online lecture on the topic of assessment of cardiovascular physical fitness. I am Dr. Sember and this is blended learning course in collaboration between University of Ljubljana and University of Porto. So, let's get started. Assessment of cardiovascular fitness is a way of measuring the body's ability to deliver oxygen to the muscles during exercise. There are several ways to assess cardiovascular fitness, including field tests, laboratory tests, and self-report measures. Here are some of the most common methods. The most common method of assessing cardiovascular physical fitness are field tests. Field tests are physical tests that measure cardiovascular fitness outside of a laboratory setting. These tests can include running, walking, or cycling, and typically involve a set distance or time frame. Field tests are useful for assessing an individual's functional capacity for activities of daily living and can be useful in assessing athletes or individuals who participate in regular physical activity. Some common field tests include the Cooper's 12-minute run test, Harvard step test, 20-meter shuttle run test, and 6-minute walk test. Another method for assessing cardiovascular fitness are laboratory tests. Laboratory tests are conducted in a controlled environment and typically involve a graded exercise test, where the individual exercises on a treadmill or cycle ergometer while their heart rate, blood pressure, and other physiological parameters are monitored. The results of the test are used to calculate the individual's maximal oxygen uptake, VO2 max, which is a measure of their aerobic fitness. VO2 max is considered the gold standard for assessing cardiovascular fitness and is a strong predictor of cardiovascular and all-cause mortality. The least objective method of assessing cardiovascular fitness are self-report measures. Self-report measures are questionnaires or surveys that individuals complete to report their level of physical activity and perceived exertion during exercise. While self-report measures are less objective than field or laboratory tests, they can provide valuable information on an individual's perceived fitness level and motivation to exercise. Of the field tests, there are also some that are the most commonly used. Cooper's 12-minute run test. This test measures how far you can run in 12 minutes and is often used in schools and fitness assessments. Harvard step test. This test measures how quickly your heart rate returns to normal after performing a set of step-ups on a bench. 20-meter shuttle run test, also known as the beat test. This test measures your maximum aerobic capacity by measuring how far you can run back and forth between two cones within a set time frame. 6-minute walk test. This test measures how far you can walk in 6 minutes and is often used to assess exercise tolerance in individuals with chronic conditions. To summarize, there are several common field tests that can be used to assess cardiovascular fitness. The validity and reliability of each test depend on various factors, including the population being tested, the equipment used, and the protocols followed during testing. However, each of these tests has been validated and shown to be reliable when used correctly. It's essential to administer these tests under the guidance of a qualified fitness professional or healthcare provider and interpret the results in the context in which the test was performed. Thank you for participating in this blended learning course, and I wish you all the best in your future endeavors.